QHSC. Thank you, everybody. Happy New Year. Happy 5th anniversary for our all QHSC family members and friends. We're so excited. The new year starts strong, and we have so many things to share with you guys and let everybody in on our little secret that we're celebrating our 5th anniversary. And we have plenty of things to share, plenty of things to plan ahead. And I'm hoping you guys will jump on and join our journey to be able to celebrate all your hard work, all the expertise, all the plans will not be possible without each and every one of you. And I know everybody's busy, and I appreciate people who dedicate and donate their time to come and help QHSC. So I am so blessed. My heart is full for everybody who comes and help us. So I'm going to ask you again, come and join us and be able to save a life, walk on somebody's shoes. And so we are planning lots and lots of things you see. So if you can join any of them to try and give a little, your time, your expertise, your suggestions, we are all open and we're always ready to run. And then so I welcome you to 2025, 5th year anniversary to QHSC family members and friends. And I am gonna welcome you again. If you have any questions, concern, I'm gonna start the meeting. So I see today we have Ms. Mi Esposo, Dr. Sekabe, Ms. Bree Vegas, Mrs. Anna Schneider-Zoman, yay, Miss Audrey, and somebody's from Buyuni, probably that's Dina, Dr. Dina Komakoma, and our very own Dr. Dorothy Wolfreck. So thank you very much for coming early. So we're gonna start the meeting. I am gonna start sharing my screen, and please let me know if you can see it. Can you see it?
No, I don't see it yet. Are you sharing?
Yes, I'm sharing my screen. Can you guys see it?
No.
Great.
Let me log out. Let me log out.
No.
I think maybe.
Okay, let's try again. Share.
Yep, there it is.
Okay,
Yep.
perfect. You can see it? Okay, perfect. Okay, so again, thank you, everybody. I saw there's 3 more people came, Mrs. Christine Beuniak, I believe, and a couple of people, I didn't see your name. So, okay, so today is the January 25th, 2025. As I said, we are excited to have everybody here. And then this is the agenda for today. We're gonna meet our leadership. We're gonna see the projects that we are working on. We're gonna see our new website. We're gonna see our fundraising website, which is Zephy. We're gonna have the tentative date for the medical mission, which I know a lot of people have been asking, and we are so excited. As of now, is July 19, 2026, up to August 1st, 2026. And then so we're going to probably be able to confirm that within a month or two, because our travel agency is trying to work on to make sure we get the best deal of tickets. So then that's where we are. But as of now, we are hoping that in the summertime. We're going to tell you the gala, and then of course, online training is going to start soon. And then of course, our best secrets, which is our 5th year anniversary. And then we're going to allow everybody to discuss. So next, you're going to these board members, advisors, and some people who have already paid their membership dues. Thank you very much. And these people are dedicated, motivated, and they really want to come and share what they have. My screen, why is my screen locked? Yeah, so that's blessed and thinking of paying forward. And then so for the executive teams, we have our continuing Dr. Siakabe as a vice president and for operations. And we have our new secretary, Ms. Bree Vegas. And then of course we have our continued treasurer, Ms. Catherine Dudek. So for the board members, we have Ms. Valentine Dante, our newest board members. Yeah, and she's been with the QHSC from the beginning. So I'm very proud of her. She's growing and moving up in the world, and she's been a significant contributor for the QHSC. So keep up the good work. We have continuous Mrs. Victoria Jones, our board members, and she's been to medical mission twice. And then now we have our newest member, Ms. Rukia Brown. This is her first time to be a board member, and she just came back from medical mission, and she saw what we do, and we appreciate her contribution. And she wants to dive in and help us a little bit more. So thank you very much and welcome. We have our very own Dr. Gwen Randall. She's been with us for 2 medical missions, and she's been the board member since the start of it. So I think this is the 3rd year now. Thank you very much, Dr. Gwen, and she's been a very strong advocate for QHSC. Keep up the good work. And we have Mrs. Anne Schneider-Zoman, our newest family nurse practitioner, and she's been with QHSC from the beginning. When I was talking to the idea, and she kept pushing me away and helping to try and design the website and all the stuff. So thank you, Annie, and welcome back. And I'm excited, looking forward to utilize you even more. Our board that advisors continue with our very own Dr. Msambi Chaka, who has been our board members, and she's done 2 medical missions with QHSC, and she's been always the consulting medical advice for our team, and she's always done a lot of online training. Thank you, Dr. Msambi Chaka. We still need your help, and she's agreed to continue doing our very best. And of course, our prayer warriors and our 4th time medical mission, Mr. Steve Jones, thank you. And he's becoming now our advisor because he's been blessing us all this time. And so we are grateful, and we continue praying for quality members who are willing to come and serve others. We have Mr. George Gabon, who's been advisor for the QHSC. Thank you. And he's helping us with the technical stuff for the QHSC website. And then we have also Mrs. Irene Gabon. She's been an advisor from the beginning, and she's always on her background to give us our nursing suggestion and stuff. So thank you for continuing working with QHSC. We have also Mrs. Kisa Mwakalinga. She's been a board member and now advisor, and thank you very much for continuing supporting the QHSC. And then, of course, the last but not least, Mrs. Behuniak, thank you very much. She's gone 4 medical missions. And then, so what a blessing. And she was the first group of QHSC volunteering group when she's been working with the nutrition and the school. So thank you for our ongoing support. And she's worked tirelessly to make sure those kids are eating. So we welcome your effort, and please continue working with us. And of course, on our side, in Tanzania, also we have our sister organization, which is NGO QHSC. We have our board member, Dr. Dina Komakoma. Also, she's worked so much in Tanzania. She's been with us for 3 medical missions. So thank you, Dr. Dina Komakoma. And she's going to continue being actively in our NGO side of Tanzania. We have Mrs. Jessica Happy Mgoni Mambus, and she's been the secretary from Tanzania side. And we have Dr. Oscar Gabone and NGO board members from Tanzania. And we have our very own Mr. Mashangarobas. She's been with the medical mission twice, and she is one of the nurses in Tanzania, and she has significance. You guys have seen her working with us and also doing the sign language. So we are always blessed to have her contribution. So that is, in a nutshell, is our leadership for Tanzania and the US. And we're excited to have people who are willing to spend their time and work with us and try to make sure the QHSC progress the way it's supposed to do. Okay, so with all that, and then I'm asking for group QHSC members. We have so many projects. People have a lot of passion that address little pieces of puzzles for QHSC. So QHSC is not unidirectional. We have multi puzzle pieces, and we're trying to solve and put it together. So we need all the expertise from every area. So we welcome, if you see any project that I'm going to mention here and you are touched by it, please join in. And we have all the people in those groups. So if you feel like you need to join any group, let me know. So, of course, we have QHSC, our family members and friends. And then, of course, we have the group for the gala, because remember our 5th year anniversary, we're trying to do the 5th try to do the gala to appreciate and thank everybody who has been donating for us, and also to give the donors and contributors the plan, what we're going to do when they give us the money. So we have to show off for that part. So, but we are always grateful. 5 years is not a joke. And all this time, people, every single thing that is done in QHSC is from people's pockets. So there's no paid in salary to anybody who is working in there. So people dedicate their time because they believe on the cause that we have. So I always thank you, and I'm full. Every time I ask people to do something, they agree to do it. So one of the biggest things that we do for this year is the gala. So if you know any friends anywhere that they can come and join us for the gala, when you start selling the ticket, please. If you have an idea of the basket, please. If you want to donate a service that can be raffled with for the gala and raising money, please join us. And we appreciate everybody who can do it. You don't have to be in Florida. You can be anywhere in the world. We welcome you to do that part. Okay, so the second group is nutrition. We're focusing on trying to feed these children for the whole year. So if you can, please come and join us. ICU, definitely we know Dr. Gwen is safety area here, and we have a lot of people from Tanzania and here in the US who can go and do some training. So we're going to try to do those training online and then go and do hands-on when we get to Tanzania. So if you can join and you have expertise in that area, please join us. Vision, definitely we know this is the biggest, one of the biggest projects we have, and we can start seeing the results. A lot of children in Minazini have been saved from this, and a lot of parents of those children have been saved. And we have a story that the Vision is going to share in later days, what a success story we have for one little girl who is 5 years old, who have never gone outside to play because they had their vision issues. And then so we are working with the doctors in Tanzania and here to try and help them. And thanks to Dr. Stenville, Vanessa Stenville, who donated the glasses for this girl, and it's going to be shipped to Tanzania. And then so that the girl will get another pair of glasses. So she'll be able to go outside in school to be able to study. So what a miracle is that? So those are the stories that we are looking for. If you guys can help us, please do. We do have another group here, is the CPR emergency. A lot of people are doing this CPR to try and save your life. People who have gone to Tanzania, either starting from 2019, we went and taught CPR in DCMC, which is in Dodoma, and then we can see the growth in that program. And that program is exploding in Tanzania and also here in United States. We do a lot of volunteer work to try and teach the community where we live in, just a simple CPR. So if you want to join us, please do that. We have prevention of postpartum hemorrhage. We all know that almost 47% of the people who experience postpartum hemorrhage, which is bleeding too much after the delivery for these moms. And then so we have to teach them basic things that to take care of them to save their lives. We have an astounding number of people who are dying unnecessarily. So if we can prevent, join us so you can go and do this part. Okay, we have a group for sports. We saw last year people who went for this Minazini, little kids jump in there and do sports, and they were able to do wonders. And then so if you want to support those children, we know for sure if they play well, then their mental status is going to be great. Academically, it's going to progress. So then hopefully it's going to break that poverty cycle. So you want to join that group, please join in there so you can help that. Sanitary pad, we all know that, but the girls are missing school because they have their periods. That should be unacceptable. However, we have to agree with the situation. We need to help them. Last year, we raised almost $7,000, able to buy those girls. 223 girls have 10 reusable pads each. So now we know for sure for the whole year, they should be going to school instead of worried about getting wet or mess up their uniform. So they will be able to get to school. So what an accomplishment is that? School supplies. The kids go to school, they don't have the backpack, they don't have this pencils, notebook. If you are passionate with that group, please join in and then be able to raise the school supplies so the kids can go to school. Thermoregulation. We all know that everybody is sensitive to these little babies. Once the babies are born, we want them to be taken care of. So definitely if you want to be able to join in and raise money, thank you to Ms. Valentine. She created Amazon links, so they'll be posted in the website and then posted in the group to be able to help people who wants to donate for that part. Did I lose my screen? Sorry. Okay. somebody came in, I was trying to admit them and then it kicked me out of my screen. Okay, so the next project is the newborn, Help Baby Breathe. I know Dr. Msambichaka, this is her baby, but now we're still joining, and Nicole and Redding and her husband are going to be also leading on that group to try and raise money to try and get those little supplies for neonatal resuscitation or Help Baby Breathe. So if you you're passionate to save this baby's life, please join in. We need your help. And then last but not least, shoes. So Miss Charlotte Williams went last year on the medical mission, and then she was touched to see the children still with worn out shoes, still go to school and smile and be happy without even worried about their barriers of, walking and getting hurt. So she decided to request this project so we're able to raise money, hopefully find shoes that those children can wear, and then don't worry about getting hurt to going to school. So you want to join them, please. That project is already started and they've already started writing letters for the corporations. If you know anybody who can help us, please jump in. So as you can see, there's a lot of things that people can do. So it's not one-sided, it's not only healthcare, it's not only non-healthcare, it's everybody who is passionate to save somebody's life, to help somebody else, neighbors, somebody across the continent. So if you can join any of the project, please let us know and we get you going. Even if maybe you're curious, we put you in the project and then you figure out if that's what is for, you can help through that part. We're happy to see that. Okay, so how can you help us? Another way is do fundraising. So there is a Zephy fundraising website that we can use. Now we're going to be able to collect all those donations. We used to have Cash App, Venmo, and all the stuff, but Cash App, we know it costs money. PayPal costs money. GoFundMe costs money. So now we get this platform is free. 100% goes to the project that you want. So when you donate, you have a link specific for a project, 100% goes in there. So we will start sharing those links starting after this meeting because I want to make sure we understand why it was in there. And then so this platform does not charge us anything else, but they accept if you want to give them like a tip for having this service. So if you don't want to give them the tip, sure, you can just say zero, don't do anything else like that. So for our membership, this is the first thing that we did using Zephy. We put the link in there and I've been sharing it in the group. So if you see it, you click on it. And if you're a board member, you see $150 a year. You get a receipt, you get a tax deductible at the end of the year. You can claim that from the IRS. So then you get your tax exempt. If you're a general member, you pay the $75. If you're a student, you can pay $50. Usually we want the active people who are in school and they want to be able to share their knowledge as a student. Sure, you can come in. And I know some people, maybe this is not the right time to pay for the membership. I understand, but you want to be supportive or participating in the event, you can be QHSC friends. It's okay. You don't have to pay anything else as long as you want to do that. When you are able, we ask you to help us. So I put the QR code right there. If for anybody who wants to pay for the membership now, you can just scan the QR code and then you'll be able to use that. It will take you straight to that page and then you'll be able to pay. Whatever you pay is going to go exactly what they're 100%. So thank you for those people who have already become members. And then thank you for the people who are willing to come and join us. As I said, I know sometimes it's tough. Sometimes you don't have the money right now. Whatever you are able to, the day that you are paying is going to be the whole year to the next year. So it's not like, okay, if I pay in March, then I have to pay again in January. No, when you pay in March this year, next year in March, then if you are still wants to join us, you can continue. So it's the whole year to the day that you paid. And you see on your receipt, the little certificate saying you are members until this date. So it should give you almost the whole year for that part. And you can use this on your professional organization to say, yes, I'm a member of a non-profit organization. And then if you need like a community hours, you can come and work with us. We'll be willing to write you a letter. You can use it for your application, whatever you want. You get an official documentation saying that you are a member of QHSC. So anybody who is a professional out there wants to use that part, please join us, pay your membership, and then we'll be happy to follow those parts. Okay, so for the history for organization. So of course, we know for sure people are also asking for the medical mission. For next medical mission is going to be 2026. So we took this year off in a sense that we want to make sure we prepare very well, and then we celebrate our 5th year to acknowledge every single thing. We have to stop and do thinking and look back and see what we did well, what we need some improvement, and we receive a lot of feedback from you guys. So keep those suggestions going on, and come and join us so we can make it better. So as of now, we're thinking 2026 is going to be July 19 to August 1st. As I said, probably by March, beginning of March, we're going to know when exactly the dates locked in after our travel agents confirm, because we're trying to figure out which time is going to be, a week before, a week after the cheaper tickets, because remember it's summertime, going to travel to a hotspot country, it's going to be a little bit expensive, but we're trying to negotiate these things. And if anybody knows any what do you call it, travel agencies who can give us a discount, or airlines who that they can give us a discount as for a group, let me know so we can negotiate and talk to them. And of course, we can publicize them and sing their praises from now until the end of the year. So of course, they get something out of it. So if you know anybody else, let me know, and then we can try to work on that part to try and make sure that we lessen the expenses of the people who are donating their time and expertise to go and help the people in Tanzania. So we welcome all the suggestions. Please help us to meet that goal. And then so this is how you sign up. The same thing. The QR code, that one's going to go to Zephy, and then it will tell you what you need to have on your screen, and then what the down payment, which is $250. Usually those are non-refundable. If you continue to go to medical mission, that $250 is included on your logistic over there. So right now, that's usually to clear the spots, because as soon as you commit, the time to commit, then I have to make arrangement in Tanzania and start securing spots. So that's why we don't want people to suggest when they're going and then want to withdraw and want to get 100% back, because by then I have to pay ahead of time to secure your spot in Tanzania. And that's why we say $250 is non-refundable. You will see on the explanation there. But also, if you end up going, that $250 also is added to your logistics. So you don't have to pay extra $250 if you decided to go. And then so this is the part that you see the website. When you scan that QR code, this is the page is going to come. You can see the top left there. It says Global Volunteer, the 250, that's the deposit. And so far for the last 5 years, we've had only the expenses less than 1,600. To be exact, it was 1,542. And then for a couple, I think it was 1,525. So because rooms and board, sometimes you share rooms, so they get discount, and that's why. But the majority of them is always less than 1,600 cost for the logistic part. This does not include your ticket and visa and your medication. That part is your responsibility, because you're going to choose whoever you want to go for your providers. You're going to choose whatever the ticket, as you want, first class or business class or economy, whatever you want. But the thing that we can manage as a group is the logistic individual expenses. Those are the ones we stay in a group, we travel in a group, we celebrate in the group, we eat in as a group. So everything else is covered. As soon as you pay that $1,600, everything else is included in there. So we are working to try and find an organization that will help pay for those things or lessen the amount, so we can share the expenses. So I'm hoping that when we are getting next year, it's less than 1,600 as the logistic part. So help me if you know there's a company that may support medical mission, then we can write that corporate letters and extra communication, and then be able to do that part. So if you're wondering what project we have, remember those groups, those are the list of the projects. And then here I added just a project. When you're logging into that part, you can say, okay, I'm interested in working people in nutrition to feed these kids, or I'm interested in vision. So we can try and put people in the group even before we get there. So before we leave from here, we can communicate with that part. So any questions, please let me know. And there's a website there. And of course, the phone number of the organization is posted in the website. Okay, so the gala, as I said, this is our highlight. The gala is supposed to be this year, end of the year. We are hoping in December, but we are still trying to find out the location that is going to give us a good discount. Right now is the sample here. When you see like, okay, the ticket for a couple is 108. That's just a sample. So once we get the location, we lock down and make sure all the things that are covered, and we want to distribute around to all those tickets, and they might be 150 or might be 200. So if we get a deal, somebody donate the whole building, then of course it might be 150, which is fine. But this is just an example. So when you are actually, we started releasing tickets officially, you see that price probably change. But this is just a sample. So if we get a corporation or your hospital or your institution or your workplace to say, oh, we want to go as a group, then yes, probably let's say for you give us $1,000. So you might get, I don't know, 5 seats or 8 seats. So but we see all the information as soon as we make it official, because we want to make sure the caterers, the decorations, the bar, open bar or cash bar, all those things, you get it very soon. So we are trying to finish up with the gala committee, and they're working tirelessly to try and figure out which is the best location. So when you get to that ticket, you see the location, you see and if we are blessed enough, we're gonna probably try and get the block for the hotels, so people who are coming from out of town. So we're gonna try to find somewhere a lot of people can stay and get a little relief from the those tickets, the expenses for the hotel. But all the information is gonna come in soon. Okay, so other thing for the monitoring, online training. So the online training, if you are expert from any of these training, please let us know, because we want to be able to include you. So prepare for the content, and then we tell you which day we're going to be hosting those. Usually it should be an hour and a half for the presentation and training. We don't want to do too much, because sometimes we do it early in the morning because of the time difference for people in Tanzania, so they'll be able to see it. So most of the time so far we've done is like 7 in the morning. So 7 to 7:15 we're done. If they have any question, then maybe 7:30, but most of the time 7:15 we are done. And then so you'll be done, and then people from Tanzania, we get the content, and then if they have any questions in the future, or there's this different session, then you can cover it up. So the area that we are looking for people is newborn transitioning, help baby breathe. Dr. Msambichaka has been there, the instrumental there, Dr. Guido, and have been there. And of course, Dr. Sharon has been there too. Prevention of postpartum hemorrhage. We have had Miss Bree there, Dr. Gwen Randall, and a lot of people from Tanzania, Sweden, and Norway. They've been doing that part, so we're going to continue doing that part. CPR and emergencies, definitely, and the ER now is an added one of the emergency areas. So we realize when we're teaching, we need to be able to identify, of course, the CPR, life-saving stuff, all those things have to be lump sum together. And then so if you're very good in crash cart, running the code, doing the EKG, you can come in and help Miss Breathe to be able to do provide that training. And then if we do need those supplies, and then of course vision screening, if you the doctor on that area, or you're a nurse in that area, or you're non-nurse in that area. So because we need the logistic people come and register and all that stuff. There's so many things that you can help us. Please join those groups. And of course, the ICU anesthesia, Dr. Gwen and her team has been doing this training, and they are always appreciated. So if you're expert in any of those areas, please come and join us. I know for the nutrition and the school, they were working on it. Once we know, then we can post the dates that the school is also working with the teachers over there, sharing lesson plan. So for all the teachers, please join us. We didn't leave you out. There is opportunities for you guys to be able to do the online training. And then if you go with us for the medical mission, we can go and do that part. So I always just say here, there, USA and Tanzania, here we come, because we're going to start doing those training. At least every month we're going to have a training. So if you're an expert, let me know which month works for you, so we can titrate and make sure that it fits on what your schedule is. Okay, so for the 5th year anniversary, so yes, when you say 5th year anniversary, everybody just assume, yeah, it's only 4 years and now the 5th year. Okay, what do we need to do? No, but we need to appreciate and show you how we are doing for the medical mission. So when we started, as I said, it was by just one person. And then in 2019, we tried out those 5 of us. And then, of course, when we came back, we realized the need is big. And then we have be able to register QHSC. And then, of course, as soon as we finished registered, COVID show up, great. But we were able to do 12 online presentation for the people in Tanzania and globally to share the education on COVID. We had a lot of expertise to join us and explain that part. So that was very well received. And in 2021, we were able to leave, going there to Tanzania. There was 28 volunteers. 2022, there was 47. So we are doing a huge training for the nurses and the doctors at Muhimbili. Almost like 400 healthcare workers were able to train there. And then we went to the school also. And then 2023, there was 24 people. So remember, sometimes a lot of people might not be as effective as only a few people. So 2022, so 2023, we learned our lesson. We went with people like actually specifically for a specific area, and it worked very well. 2024, we did the same thing. Yes, so our goal is to get up to 30 people, because if also 30 people is easier to manage for accommodation, food, and all the stuff, because sometimes you have 47 people, it's great, but you have to do 2 hotels or 3 hotels. Sometimes people get frustrated because they're far away from the main hotel. So we realize we don't want to stress people out there. So up to 30 people we can accommodate in one hotel, and that's what we want to do. So last year we went to 23 and it was great, and everybody was in it. And of course, now, as I said, we need to share that success with everybody else who have been supporting us. And that's why we want to do the gala, to make sure that we say thank you. We saw your heartfelt donations and we appreciate it. And this is what we have done. And then, so this is just a little video, the little teaser I'm going to play, and then hopefully it will give you a motivation to want to do it. No, it's just the audio. You get yours. Okay, so that was a little teaser. So then I'm gonna be able to finish it up here while my sponsor is trying to get the video you guys can see for the 5 years anniversary. So any help, any donation you want to give us through Zephy, that's all our fundraising events are going to be there through Zephy. Remember, when you donate the money for a specific project, is going for a specific project. We are not going to ration out around. No, only one fundraising that is doing for the whole organization. That's the only one which we can say, okay, we're going to cover this and this 10% here, 10% here. But you will know when you're donating, it says for all the activities for QHSC. But if you're receiving a fundraising link, it says for shoes, that money gonna go to shoes. Even if you get $1 million goes to the shoes, it's gonna stay in the shoes group. It's not going to go anywhere else. I know sometimes people get worried about, like, if I give you the money, I don't want it to go to something else. I want to do it for a specific event. That's where it's gonna go. You ready? Okay, so so before we do the discussion, I'm gonna stop sharing my screen, and then so Ms. Poso can share the video.
Anniversary. Happy anniversary. Oh. Anniversary. Happy anniversary. QHSC. Let's celebrate, save a jet. Let's celebrate with love, love. Happy anniversary. QHSC. Let's celebrate, save a jet. Let's celebrate with love, love. Anniversary. Happy fifth anniversary. You. HSC.
Ah, that was beautiful. That's so like brought back so many memories.
Thank you.
Yes, so that's what we wanted to show. If people said, okay, what have you been doing for the 5 years? That's kind of a little tips of it. Because I mean, people who have gone there, there's way more than that, but at least to show a lot of volunteers. Almost we try to capture every single one of them. If you think there was somebody missing in there, just let me know. But we try to capture every year snaps of what people were doing. And as I said, it's very, very diverse. Non-profit, and then so we can't fit on one box to say we are only this thing. No, we are almost reaching to touch every area that we can do it, because we know for sure, even if you're a healthcare worker in the hospital, you have to go to the community and save a life or train them not to become sick. And then of course that part also starts to the kids, make sure they stay in school, study and prevent infection, wash your hands, eating well, pass the exams. And then of course, even for vision, what food they can eat. I mean, so that it's all work together, like a CPR in the hospital, then CPR in the community. So that's why we're trying to spread our wings and try to cover as much as we can, and encourage all the expertise to everything we do in one place. So I want to say thank you on behalf of the QHSC, on behalf of our family. I mean, thank you, thank you, thank you. You have no idea. This is like almost a child who has been raising. I mean, we've been raising this child, and now this child is 5 years old, and we want to show them off that, okay, this is our baby and what you have done for that. So all your contribution, all the donation, all your thought and prayers have blessed us enough to be able to do this much. And we want to do more. So that's why we are asking for every little things you can think of. little cents you can spare with us is going to help us to go again for the next 5 years and be able to come and show you for the 10th anniversary. This is what we've been doing for the last 10 years. So I thank all the volunteers, all the directors, advisors, executive members, friends and families for QHSC. Thank you. Thank you. This is all for you.
Oh, I was just going to add that if you look at the video, there was a lot of footage and things that was not included, but you can see the impact to some extent. It's really large. It's really a large impact that you're having on the lives of healthcare professionals, teachers, students, patients. It's really large, and it's a small group, and it's all grassroots, with the exception of maybe a few organizations that have supported us. So this is all your work. This is your creation over the last 5 years, and also to recognize Dr. Gaboni as well for the initial push and then the consistent dedication. My heart is full.
No, thank you. So we are opening up for everybody who has any questions, suggestions, share your moments with QHSC. We're going to be continue capturing those moments. And if you want to share specific feedback for QHSC and you want to tell a story, 2, 3, 4 minutes, maybe less than 5 minutes, we'll be happy to talk to you on the side and then record that, but so we can share your impact, because there's nothing I can say enough about QHSC, but if everybody else have a different story still supporting QHSC, we want to share that to the whole world, that you are the part of this. You are the piece of the puzzle that needed to build and drive forward the QHSC.
And I was going to say too that it was mentioned that we would still have training. So like, even though we're doing the gala this year, it doesn't mean that we're still not able to reach out and do things. So like Dr. Vanessa Stenville actually is getting, or has, a pair of transition glasses for the young lady. We're going to still try to feed students over there. If we can, we want to target more or less right before the major exams, because we want to try to encourage the students to come and really get ready for these exams, because that's going to determine their success in the future. And other things, we're still going to be sending and doing things over there. We're just not necessarily going to be making a physical presence for that year. And that's because we need to really raise funds so we can kind of stabilize the foundation of the organization, whereas the projects tend to be going along to some extent, but we still need funds for the shipping of supplies and all of this stuff like that. So that's why the gala is the focus, so we can start bringing in more funds.
And anybody who has an idea or group of people that can support, especially because the gala is going to be here in West Palm Beach or Palm Beach County. So if you have a vendor who you know that they can donate their services and help the expenses, please let us know. And then so we can include them. And then just remember, there are some rewards back to them for helping us. As I said, we can put their logos in our t-shirt. I can be singing praise everywhere I go about their services. So there will be some reward for them too. So we really need their support. And then, so the more we have, the better we're going to be. And then remember, I said also for the medical mission, if you know any organization that can fund the medical mission, because I know there are some of them there. So if you know somebody else like that, please come and talk to us. You want to go to any of the projects? Sure. Or if you are undecided, you want to work with me to just support the whole organization, like Miss Roslyn, we're going to start working now. If you want to join me and then we can do it, please come. And then we can just, when we raise funds for that, we just raise funds for the whole organization. So if you are up to that part and you can't decide you want to be for the whole general people, please come and join me. I have some spot open.
And then Charlotte, you took off your mute. Did you have something to say, or?
No, I just wanted to express that I think this is the awesome thing that you have created and brought to birth, and to see it rise and grow. It's going to be awesome. I just would like to be in it for the long haul. I also would like to add the young lady who they got the glasses for, we got the glasses for.
Yes.
Stories of like that, we need to have someone to follow up on those to see how she's progressing and what have you. That's another concern that I meant to mention before, because it was such a big difference seeing that young lady when she first walked into that classroom and then when she received those glasses. It was huge. And just to see where she is now, she may really have grown and more open and just being a child. Because looking at her when she walked in that classroom, it was like this child, she seemed like she didn't have any time, any not time, but any child. You know how children are, they're busy, they're
Motivation.
buzzing,
Mhm.
and that she didn't have that.
Yeah, she didn't have
But
any hope. Yes. Hmm.
yeah, so seeing when she received those glasses, the smile on her face, it was awesome. It was so rewarding to see.
So there is a follow-up.
So
Yes, thank you for even
yeah,
touching that part. And that's why we are trying to get all those ideas. But there's a processing behind in the works that for her, I mean, we got the permission from her aunt, and then she's okay with us to speak of her. Yes, so she is gonna get another pair of glasses, and we're gonna make sure we have Dr. Atugonza Keruzi in Tanzania, who is being a liaison between QHSC and that family and that little girl specific. She is gonna get support that she needs. We're gonna be following her up for as much as we can, and that's why we're gonna need funds to make sure that she gets that support medically and
right,
whatever there's supplies. So as I said, Dr. Stanley has
right.
already made the glasses, and I'm waiting to receive them so we can ship it to her. And then so she will continue. And the girl is very happy because we're going to share the little video later on once we create the content with the way it's not supposed to be. You see the little girl is very happy, grateful, and of course still asking for glasses in the future. So which we're going to grant her wish, definitely. Those are the stories that we want. And people like you who went to the medical mission and did the vision and be able to follow it up and see that little girl, the smile on that little girl, that's what we want to see. The same story we had before. We had that little boy who was burned in the chest. That was 2022. And then so when we went 2024, they're like, oh, the you guys organization, you guys who help the name of that child that to take care of the wound. Yes. And then he said, yes. And then, yeah, the guy went to school and now he's doing madras and all this stuff. It was a very nice story. We didn't share as much because we didn't get the permission from the parents. And that's why
All
we couldn't
right.
share it. But for the little girl with the glasses, we got the permission and we are going to share that story. So those are the stories that it keeps us going. Yes.
Yes, yes. And it helps when you trying to express to sponsors and donate donors
Mhm.
that this is what you do and this is what sustain you, and seeing the progress of these children just keeps you elevated and
Yeah.
keeps you motivated. So yeah, we need to have stories such as that to keep progressing the mission on, to keep it going. But
And what, oh, do you want to say that?
no, go ahead, go
No,
ahead.
I was going to say that I'm waiting on Steve. I may have to give him a call since you just brought it up, but Steve is kind of like I guess he's going to be the
head.
the project chair of that. But I'm just
For
waiting
the
for once he
vision.
once he tells me when he's available, then we'll put it out to the rest of the group because we already have a group set up for it, and then we'll have our first meeting for that. So I know he's a very busy guy, so I think I sent him a message. What I'll do is I've learned that sometimes you have to keep prompting people because they're so busy, and so you help them
Yes,
out. So I'll
yes,
give him a call and try to nag him a little bit, but it's all good.
And Ms. Charlotte, I can share, I mean, with the rest of the group also. That is one of the challenges that the healthcare expertise had before. I think Dr. probably Dorothy Wavrick will agree with me. When they go there and identify the children who are at risk or the adults who is at risk and they needed follow-up, medical follow-up, we didn't have anything in place to support that part. So kind of like if somebody's expert and find out this person is in trouble, what next? do they need this type of test? But if they don't have the money, more likely they're not going to do it. So now we're putting
Right.
things in place, starting with this little girl. So we are using her as a little pilot to make sure all the steps are covered. So our healthcare expert is when they go over there and identify somebody who is in trouble, then we have to be able to say, come back to the board, and these are the person who, maybe Dr. So-and-so or whatever, identify this person is in trouble, this child is requiring this type of testing. What are we going to do? We are trying to make sure we have that response of saying,
Right.
sure, we can cover and say this thing should be done. And that's what we are doing it. So when people are going over there and share their expertise to try and help people who would never see any of that type of expert in Tanzania, then we should be able to answer that response. Sure, we can do A, B, C, D. Can we get them the insurance if we are able to and it's possible? Sure. And that's why we need to be able to raise money to be able to say if somebody is sick, here's the insurance for a whole year, then they can be covered. And then our experts can follow it up to make sure that that person is getting what they need. They can share with their colleague in Tanzania. We have Dr. Benera, who is on our colleague in Tanzania, who will help, like facilitate whatever is going on to be able to cover that part. So definitely that was the question we didn't have response before, but coming now this year, we're going to start to respond to that part. So when people go there and do their, provide their expertise and identify those people in trouble, we should be able to have a response in that part.
Also, I like to add the legal part of it. Maybe not so much legal, but when you have the parents or like the little girl, her aunt's consent to use their stories, are you getting written consents from them or okay?
Oh yeah,
Okay.
no, definitely. So we all know, like when you're working with a vulnerable population, which is children, pregnant women, and people who are compromised immunization and stuff like that. When you work with that population, you have to have a backup to say, I'm doing A, B, C, D. I am not exploiting it. Everything that is right for that child is going to go to that child. So we have those things in place. As the healthcare workers, we all know what you need to do and for that situation, protect, of course, the patient's identity, and then be able to support them if we can. And that's why we're putting all this part in place. No, that's a very good question. I agree. We have to be able to, yes. And that's why some of the story we've not to be able to share it publicly because we did not get the consent for that person. Yes, we can discuss among ourselves because we were there witnessing it, but we can't take it outside and share this. This is the name, this is the age. No, we can't do that. But for that little girl is the first one that at least we know for sure because we want to take it further and create a process. So next time when they identify somebody else, we can go through the process and make sure everything is protected. Yes.
Exactly. It's for the child protection too.
Yes.
Yeah. Okay. Moving right along. No.
Anybody has any questions, concern?
Yeah, this is Audrey. I wanted to add, I noticed, good morning, everybody. I was thinking that a good QR code would be for the healthcare services or emergent services, because we had a lot of emergencies that people came out of their pockets and they had to pay, they didn't have to, but, out of goodness of their heart, they pay for certain services. So maybe that could be a QR code on what Zephy is called. And people would probably really like to donate. And you could say some of the categories that people have donated in the past, and then they will know what they're donating to. Because a lot, you may not think that, people may not know that they don't have huge healthcare population, healthcare services there. We don't have any idea what goes on in other places. We have such tunnel vision. We think everybody gets the same thing, so it'd be good to have that QR code too. Maybe a person doesn't know what to pick or how to donate, and that would be a great QR code as well. And no one would have to come out of their pocket. I mean, we probably will still, but yeah, that may be an idea there. Yeah.
Yes, so that's exactly, and thank you for sharing that. But yes, that's the one of the area that we're going to be including for, like, the children. For example, the child is insurance, and it's going to cover A, B, C, D. That insurance cover A, B, C, D. And if people are giving to the child or giving for that umbrella of the medical coverage. And that's why I said, once we identify those people, the board is going to sit down and say this and this and this, yes, 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 for that part. So if we have the funds ready to go, and thank God, we are blessed enough to say, okay, if which insurance for a year is I don't remember the numbers, but it's like maybe 50,
$50.
yeah, $50, for example. So if it's $50, remember for US, you said, oh, $50 and we are paying $200, whatever. But for them, it covered them the whole year. So if we are able to do that and identify somebody who definitely they have to have who they cannot pay, and we've
Yeah.
seen them through that part, and then we identify. So all the experts are going to guide us to say, okay, this person maybe need whatever EKG, maybe this child need whatever.
Right.
If they identify those things and we are able to cover through that fund, and the fund is going to be ready to go, and then people are going to be able to, we're going to be able to cover that easy. As I said, we have Dr. Atugonza and also Dr. Banela, who are the doctors on the other side, so they can help us. Atugonza is the pharmacist, so at least even if we need medication and stuff, she will help us to make sure they're getting at the right place, and the right medication, right instruction. The healthcare people will understand when I'm talking about that. But so they know when you give them medication, you have to follow up, make sure it's 10 days, the person is taking for 10 days versus 2 days and whatever. So we do have those two people stand by for us. And then so now we need to tighten up on this side. So we're able to sell and then ask you for money. So then that link, when you start sharing for covering medical expenses, it's going to be specific for covering medical expenses. And
Oh no, I was speaking of all the emergencies, like the shoes, the
it's
shirts,
included.
everything. Okay, good,
Yeah,
good. That's perfect.
So what?
Oh,
Yeah, what I was going to say is that so we realized that so she gets health insurance, but that's a good thing if you're just going for like regular checkups. Maybe it's not too expensive. Maybe the family can afford it, but we know that there's a high probability that she's going to need other types of tests and things like that, or follow-up tests and or exams and stuff like that. So we thought about, yes, if we had a fund to have money in there to help, because if they don't have the money, they're not going to take her, even if she has insurance. So, but I think what I hear you saying, and I think would probably be a good idea too. So instead of having an emergent fund just for her, we just have more, we could have one for her and maybe an emergent fund in general, or just have one.
Yeah, in case something comes up when you're there, you know what I mean?
Oh, yeah,
We can't forecast, what's gonna happen. I mean, like when you're there, like this emergency money right here is for emergent situations that come up. Yeah.
Exactly. And in fact, you raise a good point, because when you apply for the medical insurance, it takes 30 days. So that day that they need while we are there, we have to have some money to cover. So you're right, definitely. You're right. See, those are the ideas we want. Those are constructive ideas, so we can build and make sure we have the support for the people that we identify that need more help. So then we'll be able to cover them versus just, oh yeah, you have this, see ya. No, that's not it. That's kind of, to me, I call like a bandage care, which is like, we identify what is you need, and sorry, we can't help you. We can't do that. So.
And then Charlotte, what's the name of your project?
Walking in my shoes to save my life.
You want to explain what it means?
Wow, that's beautiful.
I can't take the credit. But I will say this. I can take the credit for trying to initiate the shoe group. Trying to get children's shoes. But I thought that was a great slogan that Dr. G came up with. We embellished it. She did it, but it's awesome, because with the kids with the shoes, I think it would change their life dramatically. Even though these kids were doing, a lot of them were doing great in school, it didn't seem to bother them. But you know what? Seeing visitors such as us coming in for the mission, they were overjoyed and happy to get what they got from us, the water bottles, the book bags. But you don't know what underlying things going through their mind. So just having a pair of shoes, I know when we get a new pair of shoes, it changes us. We walk differently and everything. These kids, it will change their life to just have a decent pair of shoes. And here we have two. Oh God, I don't even want to tell you how many shoes my son
Some
got.
people have hundreds.
Yeah. And they don't have one decent pair. And then they want to preserve what little's left of the shoe when they go play. They take them off. So it just broke my heart seeing that. You know, it was one classroom I went in after we handed out the water bottles. I had to walk out the classroom because I broke down. I didn't want them to see me crying. But it was such a heartfelt thing to see. These kids were so overjoyed just to get these water bottles. So I'm thinking of shoes. That would really be awesome for them. I mean, it would really change their perspective and of just maybe want to do more and elevate themselves more in their education because they'll feel more confident. I think it will. I believe it will.
No, we
So
agree.
we're trying.
Mhm.
So anybody that's on this Zoom meeting, if you have any connect with any shoe manufacturer, footwear, I'm just saying footwear, shoes, sneakers, footwear, please offer up if you have any way of contacting anyone in the shoe footwear department or organizations, manufacturers, please let us know because we're trying to do this. And the heartfelt thing, the thing that really gets me with doing it now, which we didn't really jump on board before this thing happened in California. I don't want these kids to lose out because they're going to concentrate on California. But again, we have to express to them this is a donation. They could sponsor in ways of donating the actual item. Hopefully, they ship it as well. But it is a tax write off for them. So a lot of companies, when they hear that, they jump on it. But we would like to ask anyone for any kind of contact, please let us know. So far, it's 2 other people in my group. If anybody else want to join, please feel free.
Are you
Hi,
accepting
Vakia.
gently used shoes as well?
Yes.
Well,
Okay, good.
um, remember these is for kids too. So,
Yeah.
long as kids, but
No, I
gently.
know a lot of people who have, well, I'm gonna see if they still have, but I have a few people that are of that age, and these kids, their parents, or they're working themselves, they go through Jordans and all those name brand shoes like really easily. Like they get tired of them. They're not worn or out. They just get tired of them and buy a new pair so they don't wear them. So I can ask those people because that would be the age range that they fall in within. I would just have to figure out how to preserve them and keep them from getting smashed or something, because they're not going to come with boxes. So that would be something to look into. Yeah.
We could always stuff them with newspaper. Well, not
I
the
was thinking that the
web
old
newspaper.
fashioned way, right? Yeah.
Look, a lot of our old ways are good ways too.
I was gonna say,
Grand Rising,
um,
everyone.
Miss Kristen did a,
That's what, yeah.
oh, I'm
Grand
sorry.
Rising,
No, no,
Vakia.
I wanted to say Miss Kristen, yeah.
Okay. Yeah, we'll let Rukia go and then
Yes.
we'll,
Hey, Miss Rukia.
Hi, everybody. I
Hi.
was just listening to Charlotte, and remembering the moments when the kids was playing and they threw all their shoes in the
In the
area.
pond.
So I asked the teacher. I said, she said the kids have shoes. They just don't like to wear them. They like to play in the dirt without the shoes, right? So um, I was just listening to Charlotte when she was saying that, and I was thinking like what's the story behind it? Like, is it they don't like to wear their shoes, or what's going on? I'm not sure. So it's one to try to get a better understanding, like with the teachers, because I think shoes are, like she said, is also important. I remember Veronica and I had chose a child who was appearing to seem to be, like uncomfortable. I don't want to choose the wrong words, but just like their uniform wasn't as put together as the other children. So
Yeah.
it seemed to in our understanding, it had some kind of effect. So we asked for to be able to take that child out to buy them a uniform. And when the child got the uniform, he ran home to his parent and showed the parent, and then she told him to go back to school. But the smile on his face, the energy coming from his body was like, it gave him a sense of you know, I don't say pride, because I
No,
found those
definitely
kids to
pride.
be
Pride.
It is
They
pride.
feel
It's
like they
pride.
fit in
I
now.
feel.
Yeah, definitely. That's pride.
okay. Yeah, so like, you know, that was just, you know, when you come there, you just see these personal things. I also wanted to say that Charlotte, your advertisement is excellent. I think you should take that advertisement, put it together, and find an audience that you could really bring them into the fold of the understanding of what we're achieving here. Because like right here, most of us are well breast in, you know, QHSC and what the mission is.
Yes.
So I think that, you know, what you have to offer is it will be well received in an audience that's not very familiar with, you know. I don't if
Did
you
you?
guys understand. You understand what I'm
Yes.
saying?
No. In fact, I agree
I
with you. Oh, go
yes.
ahead, Mister.
Because I mean, if you were just pitching it here to see, you know, how it sounds, you got a good start. I still would have you to speak with the doctors to get it tweaked, you know, in a, you know, well breast way. But I think that you have a good start with advertising. I might even ask you to, you know, give me some of your
for the floor.
some of your words so that I could, you know, use it with the
No, in fact, I mean, maybe I'm gonna let them in on the little secret. Yes, so Miss Charlotte has shared with us the heartfelt story, and we have it in writings, and we have it as coming soon. So you're gonna see her being our star.
yeah.
That yes. Oh no, she has, yeah, she almost had that in tears because it was very,
Uh-huh.
very beautiful. And she
Yes.
can pull you in and you
He's a
hear
good
what she's saying.
advertiser. Yeah.
Yes. And that's why I said earlier, I said for this project, people will share their heartfelt moment of why did you choose that? Why did you select that? Why do you want to support that? So if you share that within 5 minutes or less, we can share out there and then be able to get the people understand why we're choosing that project. Definitely. And
The
then
only thing I would say is that I didn't feel like the kids were showing any shame or embarrassment.
no, they don't. They
No,
don't.
I didn't feel that. I didn't feel
Mhm.
any of that.
not at all.
I felt like these children, I kept saying it to everybody and anybody that I speak to. They expressed to me a clear understanding of what having lemons and making lemonade
Yes,
looks
exactly.
like in real
Exactly.
life.
Yes.
So like, you know, like when I came with like, you know, God, please cover me so that I don't, you know, look down or feel, you know, you know, like I'm so sorry or whatever. I never had that moment
No.
No.
because everybody was like, this is who I am, where
Yes.
I stand, what I do, and I'm working the hell out of it. I'm
Yes.
doing an excellent job at this, from the children to anybody.
Yes.
And I could not do anything but to fall in line with that and just say, where can I fit in to be
Yeah.
helpful?
Yeah.
And that was it. So I, you know, that would be the only thing I would tweak, was that, you know, that the kids felt bad or they would, you know, it would, I don't know. That's the only thing I would tweak, because I
We
don't think that they had that. I just feel like having shoes would definitely be an asset.
Yes. Mm-hmm.
And I think it would be nice if we could either get like a set of the same kind of shoes, because if you bring there with different kind of shoes, you might create something that doesn't exist.
No,
You
but
know,
no, I
oh,
agree
you
with
got
Miss.
better
Yeah,
shoes
that's
than me, I
true.
got better
Yes.
shoes. We
That's
don't want to
true.
create that. So it might be better if you could get like a donation for somebody too, so you can just go and order the same kind of shoes in different sizes. So what's your size? You know what I'm saying? Or different.
like
That's what I
uniform.
No,
More
like. Yeah,
uniform.
uniform shoes instead of like us building together and you. What your family got? What your family? Because my family might have nicer shoes than your family, your children have. And you bring all that and you bring it to the school and oh, look at yours. You got these. And no, we don't want that, because they
That's
don't work
true.
on those energy.
But it's
They
yeah.
just
That's
feel
So
like
true.
we
I
uniform.
all
think
look
you
alike,
wanna.
we good.
One of the suggestions I would say is Miss Christine Behonek, if you are able to speak, that would be great, because she has done the shoe collection project for her nutrition. So what she was asking, Miss Christine, can you speak?
Is she there?
Yeah, she's there. I see her phone there.
Oh,
I'm not sure if she's able to speak, but sometimes people maybe might be listening in just now. Her project, I'm gonna start, and then if she's able, she can jump in and speak. So her project was to collect the gently used shoes, and then she weigh by pounds, and then give it to one of the organization, and then the organization give her cash. And then so people can do in any other state that project. So you just go and collect the shoes, and then we can share the link when she's able to. We can share the link, and then you collect the shoes where, for example, Miss Audrey said, if you know people who have gently used shoes, you collect those shoes and then donate to that. But I think they go by pounds, and then so they weigh and they say 50 pounds is this X amount of money. And then so if we get that dollars and then we give it to shoes group, and then they'll be able to buy in bulk. I do agree with you. If you donated the actual shoes, you have Nike, you have Reebok, so you have this, and people be like, oh, I want
That's true.
Nike, and everybody wants Nike.
That's true.
A small, simple story. I'm gonna go back, and then I'll let you guys go back to the discussion. We were giving pencils for the kids. This was the first year in Tuka, one of the school in Dodoma. So we get the pencils, and then so of course the one donor gave us almost like 2,000 color pencils, like a Christmas color flashy pencils. And we bought the number 2, the HB2 for everybody else. So when we ran out, we started using the color ones. Oh my God. The kids will come with those 5, the regular pink ones, the HB pencil, and they said, can I get the color ones? Oh, we created an issue. So I do agree with you that if some kids have a different color and the other one, they're going to be like, no, I want the other one. So if we are able to collect the shoes, get the monetary of the shoes from the shoes, and then give the actual money, so then when we buy in bulk. Or if the institution is giving us, just give us in bulk. Like we need 1,000 pairs, which we do. Maybe we need 50 of this, 20 of that. But by then, hopefully, when we see the potential, we can get the actual sizes. And then, so right now we have just the range of the sizes. So I think that would be better. And I agree with you. Sending the different type of shoes is going to create issues.
yeah.
That's
I
true. It
didn't
happened with the bags,
Yes,
when
exactly.
we were giving out the bags. Oh my gosh. It was one color that nobody wanted. I think the blue one.
Yes.
Nobody wanted that. And I'm secretly going to tell you, I was negotiating with the kids because I felt so bad. They were like, please, let me get this one. I'm like, okay, wait, you switch with her. Do you want this blue one? I was negotiating with them really quickly on the side without anyone seeing me, because I didn't want someone to go away unhappy. When I saw an unhappy face, I gave them the color. I tried to switch out the color that they wanted.
No,
Yeah,
I
you're
agree.
right.
And that's why when
You're
we are
so right.
ordering
That
the
is an important point. Yeah.
when we
That
were ordering
happened
the
with the
backpack, we
water.
wanted all of them to be one color. But if you're buying 1,000 backpack, you're gonna run
Yeah,
out.
it doesn't work like that. Yeah.
So then we can
It,
And
maybe each grade have different colors. But then it's
it
it was
happened
fine.
with
it
the
was
water
funny
bottle.
It works with
I
the
was
water
going.
bottle too. Yes.
It was funny when we was at the hospital, and I was giving out the sanitary napkins.
Uh-huh.
I was giving out what I had, right?
Yes.
So, there were women that were plump and juicy. There were women that
Yes.
were slimmer, right? But I only had one size, right? So so somebody came in with another bag, and it was the ones that were like
The bigger.
for no, yeah, for the bigger.
Uh-huh.
So one of the bigger women was like, she held up hers. Now I don't speak the language, okay?
But you
I'm
understood.
telling you, I'm an energy person, so I can talk to you all day through energy and spirit, right? So she picked up her. She seen what I had. She was like, I held up mine. She was like, yeah. So I switched with her. The smaller to the bigger and the bigger to the small. They were ready to do it with no problem. So I think with the water bottles and the book bags, I think it was a preference of, this is my favorite color.
Yes.
Right.
More than, oh, I like this one better, because they were all the same. They
The
just
same
came in
yeah.
different colors. Like even with the shoes, I guess the shoes have to all be black, but if they were able to get black and blue, they might want blue or black, but they all the same. So it's not the same thing as if it's like Nike or
Yeah.
Puma, you know. So that's it was, but that was truly, I think about that with the napkins. Like they were like, no, could I get this? But it made sense. Like, why would I want a little thing? And my behind is a 45. I'm getting a 24. Dr. P, you looking like, okay, I'm not in this conversation, but you are.
No, I thought I heard somebody say Pluma. That's why.
I said Puma.
Oh, okay.
Isn't that what it's called? I'm listening
No,
out.
it is Puma. It is Puma.
Puma.
Oh,
I
okay,
just
good.
haven't heard that in a long
I
time.
know. That's why I was
I couldn't think of another name besides Nike and
Really?
Puma.
I
So.
wear Pumas. Really? I
Oh, I
still
wear
buy
Pumas
them.
too.
No, but I'm not saying
Yeah,
there's anything
yeah,
wrong with
man.
them.
That's the old school.
I'm not
they're
saying there's anything wrong.
inexpensive
I'm just saying
too.
it's a different version.
Yes,
I
I
was just,
still have some.
yeah, I wasn't saying
Really?
there was
Wow.
anything wrong with it.
No,
Well,
I didn't think it was wrong. I said I'm surprised people don't know about Puma. Yeah, it's been here since I was a kid. My first pair I was like 13. Yeah.
Oh no, they're pretty big internationally. I think because they keep their
Yes.
prices down, so
Yeah.
they're pretty big. Yeah.
So I have a question.
Yes. Go
I
ahead,
was thinking,
Nicholas.
when she mentioned that they kick off their shoes, um, when we decide on the shoes, or I'm not sure if we even going to decide on the shoes, but I was thinking possibly maybe if we can get like a lighter shoe, like shoes that are not so heavy, maybe because of the temperature there. I'm thinking maybe that's why they kick them off and they don't, care to wear them that often. I
So,
don't
I mean,
know.
no, I agree. I agree with the suggestion. My understanding, from what growing up, because we used to do the same thing. If I had brand new
Oh,
shoes, I don't want to get them first of getting messy because I have to keep for church day, and also I don't want them ripped, so I have to keep them. So when time to play, I would take them off, play by bare feet, and then put them on when I go home. So for them, definitely, I know if they have only one pair, if you play with it, it's gonna run over or get destroyed very quickly, and you don't know the next one is gonna come. So when it's time to play, they
mm,
will take them off, preserve them, go run around with their feet bare feet, which is for us, I mean, kind of like health issues because you're going to step on something sharp, breaks, and then you get infection. You don't have insurance. You don't have money to go to the hospital. Antibiotics.
mm,
They're going to get sick. So that's where we are coming from. We want them to wear the shoes. I do agree with you. We can get the lighter shoes, but it has to be sturdy enough because if they play with it, they're going to be ripped within a month and then they go back again to the same story. So
mm-hmm,
it's like we have to balance it. It has to be something that they can, torture it, run around with it and stay strong.
30.
Yes. So that's the part which we need to try to check when we are getting those donations. And then if they give us an option, yes. I mean, if they say, no, this is only what we have, well, we're going to say, thank you very much, be blessed. We're going to take it.
mm-hmm.
But if they give
Right.
us
Yes.
an option, then yes, we can try to find something which is sturdy. And then for temperature to make sure that their shoes is not nylon, so it's going to burn their shoes when they're running around with it in the heat. So, I mean, if we have an option, we're going to give us a suggestion. If not, we're going to accept anything that they give us. Yes.
Let me.
I have,
Sure.
can you hear
Oh,
me
there's
now?
Miss
Oh, there's
Kristen.
Miss
I was just
Kristen.
about to try to speak on
I'm
your
having
behalf, Miss
so much
Kristen.
trouble with my
Take a
phone. I was going all over the place. But anyway, I have a suggestion about the shoes.
Yes.
It's a little more complicated, but I think in the end it's easier.
Okay.
My first suggestion would be like you were talking about types of shoes. My
Yes.
suggestion is if you have 830 kids, you need 830 pairs of shoes. You
Yes.
can't give some
Yeah.
to some and none to
Yeah.
others.
Yeah, I know. We learned
I was
that.
thinking that
Miss
too.
Kristen knows that.
Yeah, it's horrible. Yes, we did learn it. But the other thing I was thinking is if we could get the donations, and this might take a couple of years to pull it off, but if we could get the donations for all the shoes, you could get 830 pairs of the same shoe. Like if we bought all blue Nikes or all just like the uniforms. If we had, so then you would take out that difficulty too of the kids wanting different, having like a uniform pair of shoes.
Yes,
right.
So
exactly.
even if we had the money, we could go there, find the specific shoe size of the kids, and then go out and buy the shoes there.
So I've spoken to my Esther Chambo, and she has shared with me places that we can get the shoes. And she was talking about, like this place and that place. I said, yeah, remember, anywhere we are going, we want all. I mean, we just say 1,000 just because I don't know. By the time we are able to do it, there might be 1,000 kids in that school.
Right.
1,000 shoes that matches every single child, and then so it has to be something that is steady enough and stuff. So she was still working on it. I agree with Miss Christine. If we have the money enough to go and buy from there, sure. But if we have companies here, the shoe companies, they want to donate the actual irregular, Miss Charlotte calls it, shoes, we're gonna take it from them and then ship it for there. So either
Right.
or, we're gonna work with both sides. But yes, we want to have to kind of like sound like a uniform for every single child to have the shoes. Yes.
Right. You know what was done with the book bags? Like you gave the better bags to the elevated kids that did well in school, achieved the achievement was better than some.
Yes.
It could be the same thing with the shoes too. Yeah, it would be great having a uniform shoe so they don't have to pick and choose. But if you get donations from different shoe
Yeah.
manufacturers,
Mhm.
then we have to weigh it in both ways. You won't give them out right away because you got to collect enough for each child.
Yes.
But if you could get the money to purchase a uniform shoe that they all look the same, that would be even better. And then if you have these other shoes that's donated, sneakers or whatever, then you could do it the same way you did the book bags for the
Yes.
children that did
The younger
excellent in
children. Mhm.
school or younger kids. Then they could get, the
One type of, yeah. Mhm.
right. They could get the other name shoe and also with their uniform shoe. So it's different ways we have to approach this.
Yes,
And the
agree. Yes.
ideas we're getting here are great. I agree wholeheartedly once you brought it up, Ricky and Kristen, about a uniform shoe. But if we get donations of shoes from the manufacturers or sneakers,
Yeah.
we can't turn them away. We
No.
have to use those
No. Yeah.
because
So
if we turn them away, we may not
That's
get
true.
anything else.
That's
So
true.
we have to look at it the same way we did the book bags. All the kids got book bags,
yes,
but
they
the
did.
ones that excelled more than others in class, they got a better or a more upgraded book bag.
Yes.
So we could do it in that approach. But
No, I agree. Yeah. So if we have 2 or 3 manufacturers that they are willing to say, okay, I can only give you 500, not 1,000. Fine. The other person, maybe they can give you 300. Fine. So we can say, okay, first to the 3rd grade is going to get this, whatever the size is. I mean, we put it like in the same class, you have the same type. So it's not
yeah,
creating issues. Because they're going to open, like, they always do
exactly.
it for the backpack. What did you get in there? Oh, you have extra pencil. She has extra. I'm like, okay. But yeah, we know when you're working with kids,
Yes,
we have to be able to anticipate that, but it's going to happen. Yes, they're going to compare things. No, so I mean, definitely we appreciate all this discussion because it's going to make us do better. And the core, I mean, today definitely we are asking for people participation and stuff like that. That will help us to have this discussion, have a good foundation, and then we can do better for missions. Yes.
So again, these groups for these projects, it's new and it's going to grow. And I think Christian said it may take a while, but it's
Which is
definitely
true.
going to grow.
Yes.
And this is the part of having these meetings, so everybody's input matters, and everybody input could go in various places if it don't go to that specific group. So I thank all who had suggestions and opinions about this because it's helpful. It's very helpful.
Definitely, yes.
I was going to say that we got Steve Jones here, the prayer warrior. Steve, I sent you a message. You might have missed it on WhatsApp. Trying to see when we could schedule the vision meeting.
Hello everyone. We're traveling today.
Oh,
Yeah, we're my mother's birthday is today, so tomorrow, yesterday, so we're on the road traveling.
Happy
So
happy
birthday.
birthday.
Happy
oh,
birthday.
yeah, she's 89 yesterday.
Nice.
So forgot about the meeting this morning, but anyway, I just woke up, thought about it, said let me get on. Well, I tell you what, let me get back with you on the vision meeting, and maybe by Monday we can do something on the we have a maybe a date or something like that.
Copy.
A time, date, and time frame can have a meeting. How about that?
Sounds good.
All right. Say hello.
Oh, we
Take
don't.
care,
I
Commando.
see her.
Oh, it was Lady V was with you.
Yeah, I think she was like
Yeah.
in the background. Yeah.
Oh, okay. So we're gonna check you. You attended, Lady V,
Yeah.
although you didn't speak today. That's good. Let's see, Dr. Dorothy, anything?
Oh, you're on the camera. Dr. Good morning.
Yes.
As far as the school supplies, I noticed like someone had some containers collecting pennies. So I thought about asking to be able to do a penny drive at our school.
Okay.
And that's one way of raising some funds.
No,
But
that's
along
great.
with that,
Yeah, fun.
along with that, just donating some funds, to match the penny drive.
Oh, okay. No, sounds good. Yes, that's very good.
Yes.
Thank you.
You're
Dr.
absolutely right.
Dr. Dorothy?
I have something that directly goes against something that people have been saying, but it's true that you gave the nicer things to the people who got the better grades.
No, the
No, I shouldn't have said it the way I did, but go ahead. Clean it up, Dr.
this is
G.
what this I'm going to explain it. This is what happened. One of the volunteer from New York received, I believe, 50 or 60 bag from the church, which is full surprise in there. By that time, we already bought all the 1,000 backpack with this supply that we have. It was not the same as the ones that they are full loaded. So because we couldn't give to on a few, we gave for the top 4% of each grade. The second bag, that because they did it very well, then we give them those donations because it was full bags. Maybe they were stronger bag because they're bigger bag even for the little ones, because there was only 60 bag and we couldn't give it to one grade because every grade we have more than 80 students. So we only gave 4% of each grade. They got an extra bag because they are doing well. Try to inspire others to
Right.
work well to get a second bag. And that's why maybe yes, she used maybe the word better, but it's just because we had only 60 bags, not 900 bags now.
Right. Okay. But what I'm thinking is sometimes kids that are at the bottom of the class are there because they have harder times. They can't see well, they can't hear well, and maybe they have learning problems. And then they see that the kids that do really well get better things. Then why should they even try? So sometimes I think it's just like starting at the end of the alphabet, for heaven's sakes. How many times have you had to line up by your name? I was never at the front of the line. Now, as a little kid, that ticked me off.
Yeah, me too.
And when I was little, I needed glasses and nobody knew it. And finally I asked, what does it take to, and I sat in the back because I was a W. I said, what does it take to be able to sit where you can see the board? And everybody went, holy cow. So it's just, sometimes I think giving the kids who are having a harder time, maybe giving them something a little special might make them, give them more self-confidence. That's what I'm saying. But if everybody got a bag and then some people got special bags, well, then that's okay. I was thinking that, okay, well, these are the good bags, these aren't the ones. So anyway, so Charlotte, I think what you're doing is wonderful. And I think the shoes are wonderful. I think all of this is going amazing. It's just amazing. But I just had to say that about the underperformers because
I
it,
understand what you're saying, Dorothy, and to inspire the ones that's not doing so well. It this is a program or a project that is coming to birth. So we're having these meetings too to get everybody's point of view. And I like you brought that up about, being last online or last because your last name, because I was there too, Williams. So I know
yeah,
how
you
it
and I,
felt.
we would have been neighbors.
Well, look,
We would have
the
shared a
only
desk.
time I was up front was graduation because they went by height.
I know.
So thank God I was shorter than a lot of people. But you know what? To inspire those kids to do better or give them some incentive, we have to plan something for that too. So
Yeah.
this is going to bring up that issue now, what you just introduced. It's going to develop, we have to develop something for them too. And that's a good point you made. So everyone's opinion and points, it's something that we have to really look into and try to organize something for the ones that's doing less than the others. Try to inspire them because you don't know what their reasons are. Like you said, it could be vision, it could be things are not well at home. So a lot of this will inspire them thinking of ways that we could focus on them as well to bring them up so they can elevate more too. So I thank you for that. So we got to look into that. We got to think of a plan for that too.
Yes, Ms. Fraser, I'm going to give you a chance to speak. Let me respond to Dr. Dorothy quickly. So I do agree and appreciate the suggestion and the question, which is going to make us think a little bit more. One of the
Yeah.
ideas that we thought was not giving them backpack either, but it was Mrs. Victoria Jones, also is a special ed teacher here in the United States. So we were talking about people who were struggling. We have to screen them vision and hearing. We know that part. So the children who are struggling, she was going to work with the teachers over there to try and find ways how to help them. If there is a way of something to enhance that process, it would be great included. And I appreciate you mentioning that so we can add something to them, but we wanted to make sure that they get the support academically first to help them, like reading if they're struggling and stuff. Of course, we have to address issue for food, for health and stuff. I understand that part. We are addressing that part. But I know mentioning that it's going to make us aware of we need to do a little bit more for those who are struggling. They might not struggle because they don't want to learn. It's just because they have so many barriers to them. So we have to address that. So thank you for saying that part.
And then also before Miss Phyllis speaks, they also might be like me. They might be late bloomers. So
That's true.
it might take them a while to catch them.
Yes, Ms. Pierce.
Yes, thank you. Oh, yes. So I wanted to say thank you to Doctor. I am, excuse me, also neurodivergent. And so I was that student who always felt that way. Like, well, what about me? Because I always tried to work harder, And so people will say, "Oh, well, she's kind, so I'll give her something." I don't want someone to give me something because I'm kind. I want someone to value me because I
I
tried.
try,
And
exactly.
so I'm asking that if if possible, like every time, and it's so funny you brought this up because this came to mind to me even at my age today, like wanting to do something for children who are excelling, but also wanting to do something for children who have excel exponentially. Like they went from being an F student to say a C student. You
Yeah.
know what I mean? Like I want to do something for those children. Every time we talk about the ones who are doing great, let's also talk about the ones who have advanced.
Yes.
From whatever that level is, they have advanced from one to the next. So thank you.
Yeah.
I'm sorry.
Sorry, go ahead.
So I'm really definitely glad that you guys are sharing that, because Mrs. Victoria Jones, she's going to include that in that group because she's in charge of that collaboration and making sure that the students here in the United States also communicate with the children in Minazini. So this is the part that definitely your feedback is needed so we can make sure that we address. And I agree with you, Mr. Phillips, that definitely we have to be able to help the people who are from F to C. They might not there at A, but F to C, they're trying. So we need to be able to say, okay, come on, continue that part. So definitely it's going to make the program better. And we have 3 teachers who join us this year. So that's even better. So we're having a little more help in that area. So and having this feedback, it's going to empower them to do a little bit more for those children. Yes.
Thank you.
Yes,
This is so great.
And I think I've heard the term neurodivergent. I am kind of old school, so now I know that that is the term now. I can never figure it out. I'm like,
Right.
which term do I use now? So now I know
Right.
it's neurodivergent. But what I was saying,
Neurodivergent. I have
huh?
another thing to add again.
Yes.
I actually work with 2 Down syndrome kids and a neurodivergent kid right now. And I was thinking a really good approach would be, instead of rewarding the top 4%, maybe we could reward anyone who jumped, 5% or 10%.
Oh, they most improved or
Yes, that's what Ms. Phyllis was saying. Yes. So that's something that we need to think about it too. Yes. And still address the people who are struggling. Definitely.
Right. So you can take the lowest who came up 10% and the highest who went up 10. And
Yes.
that rewards effort instead of
excellent.
intelligence.
Yeah.
Yeah,
Because I
I
was having some challenging times too.
yeah,
At home.
I was gonna reiterate because we were talking and I used an example, and what I try to stress to people, this is what I've learned in terms of dealing even with the elderly from my family. Everybody wants their life. Like you said, you don't want to come up. So I worked, did a little special ed substituting with Fairfax County, one of the best in the nation, and they get jobs for the children. And I'm, so I was trying to explain too that these jobs, these little things that they do for them, like my math teacher when I was at Brandeis High School, my math teacher was wheelchair bound, and he had to come in a special exit. But these little, like when we help the girl with the glasses and we help them to get an education, or if we can help people to then get shoes and integrate into these things, make a big difference, and it gives them that come up that they need for them to feel confident in themselves and know that they're ready to take their place. It doesn't matter how old they are, even for like an elderly person. I like to tell a story about my grandfather. He got so old that he only had one job, and that one job was to take the grandkids to school, and he would fight you over that one job. So those little things, those little things mean a lot to people, and especially some of them, like I said, they're not integrated fully into the world that we've created here. So it's something that's really important. So yes, I agree.
Yeah.
So that's what we do these meetings, so at least people can share their feedback. And yeah, this is very, very enlightening. And Dr. Dorothy, keep us straight. Keep sharing your feedback so we can continue growing. And then, of course, for everybody who contributed to that discussion, Ms. Christine Behuniak, you have your team for nutrition, but also you can join with Mrs. Victoria Jones to help with that, because that's her area right now, and she wants to do the school surprise and working with the children who have special needs. So definitely, since you have that experience, you guys can work together and help the teachers over there to be able to identify the children who are struggling. What are the things that they can do to help them and build up? And of course, if we raise enough money, so at least the children should not be thinking of food. They should know, okay, I'm going to be full and I'm going to focus in school and what I'm getting all this help. The same thing in Ms. Charlotte is going to be doing the shoes. So they have the shoes, they have the food, the belly is full, then they should be able to concentrate in school. And of course, Dr. Dorothy can help with the vision screening, hearing screening, and then help them. They can make sure the kids can hear. Because some of them, last time when they did the screening for kids, find a lot of kids who have hearing issues because they have an ear infection infection which was not treated. So all that makes the child, it doesn't want to learn, can't hear, they struggle, they sit on the back and they're losing that opportunity. So them be able to identify those children. And in fact, I know I have to say thank you for Dr. Dorothy and Dr. Msambichaka. They took upon themselves continue, go and get the medication for these children, and the children were able to receive that treatment. So without that, I mean, who knows what the children could have continue without getting treatment on their hearing issues. So those are the things that we are trying to attack every angle to try and help that child stand on their own, learn, and see their full potential. So thank you for everybody who is doing a little bit here and there, but that's what it goes with our saying, haba and haba. Yes, make the word go, I mean, better. So thank you, everybody. Yeah.
Yes, and Miss
Hi.
Evelyn, we will get with you. We have some ideas, so little by little we're plugging you in. So
Hi, I
Okay.
was gonna say, oh, sorry. As an incentive, maybe 6 months out, we can tell them the percentage that they need to raise their grades. Or I don't know how their system goes with grading,
Oh,
but
that's
we
a
can
good
let them
idea
know
too.
what the expectation, and not telling them what the gift would be, but let the entire class be on the same footing by letting
Oh,
them
that's
know
nice.
that will be an incentive to let them know what we expect, like the 5% or the 10%, the top, whatever of those children, and that way they'll work hard. And it's really going towards what your original idea was, to have the kids excel, so they will do it on their own, and then you wouldn't be picking and choosing from someone who didn't have a fair shake, in that
That's
situation.
true. That is
Yeah, they
true.
will all be on the same footing. If they want to do it, they can. If they don't, then you'll know the numbers, so that would be a way to gauge
Miss
who to
Phyllis, you
give the
wanted to say
special gifts
something?
to.
Oh, okay. Okay. Now this is great, great. Please keep those discussion going. If we don't have anything, Mr. Steve Jones, are you able to close us with a prayer? I know you're driving.
Yes, we can. Are you all ready now?
yes, wait a minute, Victoria, grab the wheel. Hold on.
Well, she's already driving, so we let that go. We'll
So
let
she
that
knew
go.
that. Okay, go ahead.
Yes, yes. Dear Heavenly Father, we just want to thank you, oh God, for just a wonderful day today. For this is the day that the Lord has made, and we shall rejoice and be glad in it. God, we want to thank you for the meeting of today, oh God, that we had. Thank you for our minds coming together concerning the kids, the shoes, and all the things that you are doing this year, oh God, and in the years to come. We ask you to bless everyone that's on the line, oh God. We ask you to bless everything that they said and put it to fruition, oh God. That
Yes.
it be able to grow, multiply, oh God, and
Hallelujah.
blossom and multiply. This we ask in Jesus Christ's name. Amen and amen.
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 Thank you.
Amen.
You're so
Thank you.
welcome.
Yes.
And happy birthday.
Oh, yeah,
Happy
absolutely.
Hey.
birthday to your mom, Steve.
Yes. Yes, no, thank you, everybody. Thank you, thank you, thank you. Just keep an eye on all those messages. We're gonna start getting a lot of information in the group chat. So respond, and then you're gonna see on each group that you are in, you're gonna start seeing more links to stuff we start forwarding in there. If you have any question, don't hesitate to call us, please. And then we're gonna start posting office hours where we can communicate with people. So please share your suggestions, and thank you very much for every single person who suggested something. We are learning, we are all
Yes,
learning, and then this QHSC is for everybody. So thank you. Feel free to share your suggestions, discussion.
I do.
Yes, so we appreciate every one of you. So thank you, and have a blessed Saturday and the rest of the week.
Yes.
Thank
Have a
you all.
blast.
Bye.
Thank
Thank
you
you.
too.
All
And
right.
you as well.
Bye.
Happy birthday as well. Everyone have a
Kwaherini.
great day. Great week.
Kwaherini.
Ashe, ashe.
Bye.